Dr. LeBlanc, let's talk about missing teeth. Here's what I have noticed. Dentists keep telling the patients, as patients, that we got to replace those missing teeth, especially in the back, when sometimes us patients have a tendency of not fixing them, not replacing them. Front, not so much a problem. It looks ugly. We run to a dentist rather fast. But in the back, not so much. And sometimes years later, literally, at least from us patients' viewpoint, nothing bad happened. And yet you dentists keep saying you got to replace them. Can you shed some light about this discrepancy which is there apparently? Because some of us think it's only a money thing, kind of like want to sell us one more whatever. Tell us.
Well, the truth is, Helmut, millions of people without any teeth in the poorer parts of this world prove every day that you can survive without teeth. So much of it is a want and not a need. If you are missing one of your two front teeth, it's not going to affect you in any way but aesthetically. Now, most people would certainly agree they don't want to walk around with a missing front tooth. As far as the back teeth goes, there are some issues. If you lose a bottom tooth, the top tooth can grow down into the space, and that becomes a problem. But again, most people find a way to function okay, but generally they want it. I'm on the line that I don't get people in here and try and talk them into anything. They generally want something, and then through discussing it with them, then we figure out what ways we can get to where they want to be, because there's different ways of replacing missing teeth. The only argument that I can come up with for the need would be digestion. Chewing is the first part of digestion. If you're chewing your food properly and it gets to the next stage, which is your stomach, in a well chewed up form, you're going to digest food better. But again, I am not going to sit there and say, if you don't do this, you're going to die or you're going to get kidney disease, because that's just not true.
Okay. All right. Now, obviously, in the chewing, we've learned that in school. You know what I mean? Even
Right.
old guys like me already learned that in school. And at the same token, like when my wife and me sit down and having a steak, I have eaten that steak. I'm already running around, texting messages, doing things, and she's still on the first bite. And she says, "Honey, can you please keep sitting? We're still eating." So meaning I don't chew. And well, I don't know whether one day that will hit me like a truck or something, but let's go into something else and tell me how much merit that has. There are definitely people out there, dentists in fact, and even, chiropractors and other people who say, all right, here's what's happening. You mentioned that a tooth can grow down from the back because it has nothing to support. Other dentists say, and then you probably agree, that the teeth start maybe shifting, not fast, but maybe. And here's what that does. Obviously nothing to the aesthetic, because so what? Maybe you don't chew, you chew one-sided, but all that seems to be moving the muscles in the wrong way. It could create your hinges here, your jaws, which is I guess called DMJ, to be out of alignment, lots of muscles attached, and people could get headache, shoulder pain, shoulder tensions, even lower back pain. Not have to, but could. And the missing tooth isn't the only thing which can create that. But that type of environment could be creating, which would be then a lifestyle change. Because a person running around with tense shoulders, or he has problem driving, it just life isn't so good. He might become less productive, more sidetracked. The quality of life is not so good. Does that have any merit? What I just mentioned, could that happen?
The last thing you mentioned, Helmut, the quality of life. We all want to just go out and be with our friends and family and enjoy ourselves. If you're in a restaurant celebrating a child's birthday or a parent's birthday or a friend's birthday, you want to have a good time. You don't want to be the guy sitting there or girl sitting there that just has to eat potatoes, mashed potatoes, because she can't chew. I don't know if it's going to cause headaches. If it does, then we go there. But again, it's a want. People want to be able to chew. They want to be able to enjoy life, and eating is one of those great things in life. And with the implant technology we have today, with the crown and bridge technology that we have today, there's just really no reason that you need to go around without your teeth. You don't have to have full dentures that are falling out every time you talk.
Okay. Well, I appreciate your candidness. And I'm sure it will be refreshing to lots of people to know that it is a choice, because it is true that in many offices you probably get told it's all hell breaks loose.
Well, Helmut, I have an interesting philosophy on that, and it's called my worst case scenario philosophy. If you don't do something, what's the worst case scenario? If you have one back tooth missing, what's the worst case scenario? You're not going to die that day unless you get hit by a truck. You're not going to get kidney disease. It's a matter of comfort and want. And really, the people that I run into, most of them want to be able to chew. If it's the very back tooth, generally they're doing okay with it. But any tooth in front of the back tooth, it's just uncomfortable to chew it. Unfortunately, again, with the options we have available today, we can replace teeth, which is a fabulous thing. Well, so I would advise somebody that is missing a tooth to go talk to somebody about their options. And there is not one option. There's always more than one option. And we're going to make sure you know all your options.
We're going to get into those options with no doubt, because those options, again, they are... Because as more options there are for all of us in anything in life, as more we sometimes are confused. And I guess a straight talk from a guy like you might just put that in a good perspective. Let's do that another time. Thank you very much.
That's very true. Thank you, Helmut.